All right. Yes, we do understand this being live streamed. Perfect. Well, thank you everybody for joining us this evening. I want to quickly introduce our guest, Dr. Henry Lindner. He is a specialist who previously has presented on chronic babesiosis at ILADS. He graduated from the Jefferson Medical College in 1984 and has worked privately in psychiatry and endocrinology, as well as in general practice for the Air Force overseas. He was introduced to tick-borne diseases when he removed 2 engorged ticks off of his 10-year-old daughter. After a delayed diagnosis and underprescribed prophylactic treatment, his daughter has since developed a chronic infection and has been physically and mentally disabled ever since. Dr. Lindner's personal experience with Babesia has led him to dedicate his life to education and treatment surrounding this still somewhat unknown infection, and we're very happy to have him with us this evening to present on this topic to Project Lyme's community. So I will start with some questions, Dr. Lindner, and obviously for everybody here, we will open up to a Q&A later, but please save all questions or put them in the chat for now. We'll get to it after we work through our outline. So to start, the first topic is, what is Babesia? Obviously, we know that Borrelia burgdorferi has been compared to syphilis because of its similarities in presentation and spiral-shaped appearance, and Babesia has been compared to malaria. Can you outline the background of this discovery and explain Babesia malaria's relationship and similarities?
Yeah, sure. Lyme is a relatively simple organism. It's a bacteria. It has a much smaller genome. It's not a sophisticated parasite like Babesia species, particularly the one we'll talk about tonight that's causing chronic infection. They are very closely, Babesia species are very closely related to malaria. The Babesia species are a protozoa. They inhabit red blood cells in the host. The Babesia species that has turned out to be so much of a problem in the eastern US and Canada, Babesia odocoilei, has a particular trick that makes it a very stealthy parasite that infects people for life. And that is that it enters red blood cells, causes the red blood cell surface to be changed. In this case, I'm certain it attracts fibrin. It causes fibrin to deposit on the red blood cell. That is a part of a blood clot. It's a protein that which forms blood clots, and it makes that red blood cell sticky. It stays in low and slow flow areas, like in capillaries, blocks them up, and this creature literally creates a nest in capillaries and small post-capillary veins, venules, throughout the person's brain, heart, lungs, bones, muscles, you name it. The Babesia are everywhere, in some tissues more than others, but it is a stealthy parasite, especially the Odocoilei and other sensu stricto species. So it's a far more sophisticated organism than Lyme. It produces a very different clinical state, and it really is unknown up until the present day. I had to figure out what was causing this chronic infection in my daughter. She did test positive for Babesia infection at IGeneX, which is really about the only lab that and T-Lab can do tests to find this infection. She tested positive, which was the big breakthrough. But I could talk more about her later. Go ahead.
Yeah, thank you so much for introducing that. And I think a great follow-up question is outlining that obviously there's hundreds of species within the genus of Babesia, and you mentioned one of them, but I know there's a few other strains that exist that can cause infection in humans. Can you name a couple of those other active strains, even if you don't go into more depth about them later?
Sure. The mainstream, the medical authorities, infectious disease people, they believe that almost all babesiosis in the United States and Canada is caused by Babesia microti. This organism is in less than 3% of deer ticks. It does not cause chronic infestation. It makes people, many people don't get ill at all with it. People may get a fever, be somewhat ill, and have some hemolysis or breakage of their red blood cells in their circulation. But people without a spleen are the only ones at real risk for Babesia microti, and the body clears it after a few months with or without treatment. Treatment just speeds up the clearance of the organism from your blood. So it's a non-issue when it comes to chronic disease. It is not Babesia microti. There are very few of some other organisms that have been reported in the US. There's Babesia duncani, which is limited to the West Coast. It's in a different tick, and its host is the mule deer. And humans essentially seem to get sick only when they're splenectomized, don't have a spleen to get these Babesia infected red blood cells out of their system. Very few cases of divergens, Babesia divergens, which is more common in Europe, and B. venatorum, which is very closely related to Babesia odocoilei. Odocoilei venatorum is also infects deer, the red deer in Europe. But here in the US, like the Pennsylvania Tick Lab has not seen anything except Babesia odocoilei in about 17.5% of all deer ticks they've looked at, and Babesia microti in less than 3%. They have not seen divergens or venatorum or these other species that are known more often in Europe.
Okay, very interesting. So I know you've mentioned that obviously North America and Europe, you can find these strains. Is there anywhere else in the world where people may be
everywhere?
Fair enough.
Yeah, they're in Australia, they're in Asia. Venatorum was reported in many people in China. They're everywhere. So that's one of the things, like the Australian authorities claim there's no Lyme in Australia, so they don't believe anybody there gets tick-borne disease, but they get chronic babesiosis.
Right. I mean, I feel like it's pretty straightforward. We know that ticks are everywhere, so why wouldn't tick-borne disease follow it? But I mean,
and ticks are carried everywhere by birds.
Yeah, exactly.
Migrating birds have these, these deer ticks, Ixodes species with these parasites, and they take them and drop them everywhere.
Awesome. Well, I think you've done a great job of outlining the background of what Babesia is. So I now want to jump a little bit more into the meat of things, which is the signs and symptoms of it. So when may someone suspect that they've been infected with Babesia versus maybe one of the other tick-borne diseases?
Yeah. Babesia odocoilei, the only one really worth talking about when it comes to chronic illness, can present acutely in some people, a minority, I would say, and less likely in children, but some people can get ill for a couple weeks or a month or longer, just, kind of very fatigued, bedbound. They may have low-grade fever, night sweats. Generally, these Babesia odocoilei, because it sequesters in the circulation, is not seen in the bloodstream of these people. So the usual mainstream test will not see any Babesia in a person who's acutely infected. After the acute infection, the organisms, maybe, within hours or days of infection, you might be able to find these organisms in the bloodstream, but very soon after that, they've sequestered in the capillaries. This has been well described in dogs with a very similar infection, Babesia canis. And then most people will have little to no symptoms of the initial infection, but will gradually maybe never become symptomatic if their system has contained this parasitic infection very well. They don't have a lot of parasites, but many people will notice some degree of fatigue that creeps into their life, a tendency to brain fog or reduce cognitive function. The fatigue of babesiosis is very, very, very distinctive. As a matter of fact, I think it's the only tick-borne disease that causes chronic severe fatigue and really serious fatigue. So one must think of babesiosis when people don't have energy because of the specific things it does to the body. And so the classic symptoms like that are described at your website now do not happen to most people, except in acute babesiosis or when the Babesia are killed by antimicrobials. And that's the classic shortness of breath, palpitations, low-grade fever, night sweats, several things like that are described. In my own journey, and because those descriptions are given for babesiosis, I never thought my daughter had babesiosis because all she had was low brain energy, primarily. She would have a few hours, she could do things, mentally, but then she would just totally run out of energy and be done. And she had to portion out what she was going to do very carefully so she'd have the energy to do it. These people often have energy in the mornings, but by some time in the day, if they're active, they hit a wall and they just can't do anything else, get severe fatigue. If they rest, they can get a little energy later in the day. The mental issues can be depression. I think even more severe things like psychosis, seizures in some people with severe infestations and/or severe immune reaction to the bugs. Those are the two things that determine what happens. How many bugs you get, and I like to call them bugs. It's a quick and easy term for these protozoa, and how much you react to them immunologically. If you have a strong immune system reaction, then you're more likely to have low-grade fever and night sweats and such. If your body doesn't react to them very much, if they're basically under the radar of your immune system, you just start to feel what I call the direct effects. These nests are blocking your blood flow in so many tissues and creating some localized inflammation only that affects organ function. It can affect the respiratory system with cough and trouble breathing. It can affect the bowels, causing severe constipation or irritable bowel syndrome, alternating constipation and diarrhea. It can cause muscle fatigue and muscle aches, and really urinary issues. I think interstitial cystitis in many people is related to this chronic infection. There's really almost nothing it can't affect. And when this was described in dogs with Babesia canis, a very similar infection, they called it multi-organ dysfunction syndrome. So I found when I was looking to try to understand what Babesia is, what Bartonella is, what symptoms they cause in people, the very best descriptions I found were actually by a Dr. Wayne Anderson at gordonmedical.com. Under his bio, he's got a description of Babesia-like organisms and Bartonella-like organisms. And that's really the most helpful description I've seen anywhere of what actually happens to people who get Babesia and or Bartonella.
So just to recap, you're stating that a lot of the main symptoms of, say, an early stage doesn't necessarily overlap with those who are presenting with a chronic case. And most people will not be diagnosed with this until they are chronic. They've been infected for a long time. The early stage, if they were sick, maybe even hospitalized, the doctors didn't pick up what it was, and if one is given doxycycline, it doesn't do a thing for this infection. Even if you give it immediately, it would not stop a person from developing this infection from a deer tick. And again, it's in 20% of them. Lyme is in 30%. So it is more common in the deer ticks than this, but this is close. And there's another big problem. This is in the larvae. It is a Babesia sensu stricto species, and ticks are born with it. You need only look around on the internet, or if you find one of my PowerPoints, to see that a larvae is practically invisible. Nymphs can carry Lyme, but that's a larvae who has fed from an animal and gotten Lyme. Then they can give you Lyme, but larvae can carry Babesia from hatching. And so this species is more sophisticated, more adapted to tick-borne or tick transmission than Lyme is. Interesting. So before we move on to treatment, because I know that's kind of the main crux of what people are interested in, I wanted to touch back again on the concept of testing. You had mentioned Agenics and one other lab, but what is the process of testing, and is there existing issues very similar to testing for Borrelia burgdorferi?
Well, first of all, no lab in the world will detect this infection except perhaps Igenics and T-Lab. And their tests are good, but they will be negative in many people who carry this chronic infection. The tests at Igenics are their fish test, and that actually is where a fluorescein stained probe attaches to some of the RNA of Babesia, of a specific Babesia species or Babesia genus. They have a Babesia genus fish test, which will show if the bugs are in the blood at the time, it will actually show that there is an active Babesia infection. So that is a very helpful test. When it comes back positive, it means there is active Babesia infection. The question is what species, but again, the only one that I know of in the entire eastern US and Canada that produces chronic infection is Babesia odocoilei. They have also at IGeneX an immunoblot test. This is new since August, which can look for antibodies to Babesia duncani, Babesia microti, but also Babesia genus antibodies, which can pick up the Babesia odocoilei antibodies. Genus means just the whole Babesia group. So it's a general antibody test for Babesia infection in general. And TLab has produced a Babesia odocoilei fish test. So a test that is specific to I heard the recording stopped. I don't, and my interviewer has disappeared. If I'm still on, I don't know what to do. Is anybody listening to me? Can you hear me? I can see some questions and answers. Okay, you can still hear me. So I guess I will keep talking. Our host disappeared for some reason. Somebody asked about the website. Again, you have to look up Dr. Wayne Anderson, a naturopathic doctor at gordonmedical.com. Look at his page on that website. And it has all the these descriptions of Babesia and Bartonella symptoms, which, as I said, are really the best. Yes, so TLab in Maryland, run by Dr. Robert Mosiani, a really fantastic scientist. He has developed this fish test that's specific for Babesia odocoilei and can show that it is an active infection in a person by finding, remnants of the ribosomal RNA in the blood. It's not completely sensitive. Neither are IGeneX tests. People can have this Babesia infection and just come back completely negative on every test you do. And so ultimately, the diagnosis may have to be clinical, meaning, the doctor uses his brain, which doctors don't like to do very much these days, and thinks about what could be wrong with this person, and could it be babesiosis? And if they suspect babesiosis, it's good to get testing. It's always good to try to get more information. We are back with our host. And if they suspect babesiosis, it's good to get testing. Hello, Noah.
Hey, Dr. Lindner.
Yeah.
Did you stay on?
I stayed on, so I kept talking. So, and
awesome.
Yes.
Perfect.
I'll just keep doing so for the minute about diagnosis.
Perfect.
So the yes, so one may have to simply resort to clinical judgment, clinical thinking, if babesiosis has a high likelihood, given the person's fatigue and other symptoms. And and believe me, I see this a lot. My practice, my endocrine practice started to attract a lot of people who had fatigue and brain fog, and maybe achiness. And so I accumulated a lot of these patients. I tried to help them with thyroid optimization, even with hydrocortisone, replacement therapy for the body's powerful steroid hormone. These helped some people, but it wasn't until I had to figure out what was wrong with my daughter that I realized that I had many of these people in my practice already. I thought what she had was rare. In fact, it's very common. I probably have 100 people in my practice with this infestation, varying from very mild symptoms to severe. But getting testing is good. IGeneX, Babesia fish, Babesia immunoblot, and/or T-Labs fish, Babesia odocoilei fish can show evidence of the infection. At IGeneX, you won't see the species in particular, but if you get positive results back, it's almost certainly Babesia odocoilei. Although B. microti infection in the past could give you positive B. microti antibodies, but not a positive fish. Clinically, what you do is you do what doctors have done for 100 years or more, which is give the person something that will affect them if and only if they have this infection, and give you an answer. And with Babesia, that's very simple. It's not so easy with Lyme, but with Babesia, it's simple because it is so close to malaria that the treatment is basically anti-malarials. And malaria is a protozoa very different from bacteria. The medications that kill malaria, like atovaquone, better known as Mepron, or tefenaquine, or any other, which is very potent, or any other anti-malarials, if you give these to a person who's Babesia infected, and if you give them, in some people, you have to give maybe a couple of them if they have a very low-grade infection. But in some, even one dose of one of these anti-malarials will cause them to have a Herxheimer-like reaction, which I think is perfectly well called Herxing. It means that the immune system has been alerted to the presence of an immune-evading parasite. It was hiding. Very happy to evade your immune system, stay away from it, not make you too sick, but now you go after it with an anti-malarial and disable and kill it, and the immune system sees the organism, and so you're going to have Herxing, which can be, worse fatigue, worse brain fog, achiness, sometimes even night sweats, low-grade fever, headache. Basically, you feel a whole lot worse. Sometimes you feel a little better before you get worse, but usually you at some point will feel worse when you start killing Babesia. And so that's diagnostic, in my view. We don't have malaria here, so nobody has chronic malaria, most likely, in the eastern US and Canada. But everyone is exposed to ticks if they've spent any time outdoors. And because it's in these larvae, they may have no history of a tick bite, but they certainly could have gotten it if their symptoms suggest so. And they definitely got it if they react as expected to a trial of anti-malarial medication.
Awesome. Well, thank you all for bearing with me as my power dropped off. I wanted to quickly say that I see several hands raised in the attendees list. I would ask that any of you who have hands raised either put your questions in the chat or in the Q&A box, and we will try our best to get to all of them. Just Dr. Lindner, I'm not sure how much you covered while I was away, but I want to move on to the treatment.
Yeah, so more on treatment. Sure.
Awesome. Perfect.
The patient and the doctor who take on this organism have to know that they're fighting with a very, very sophisticated parasite, really the most sophisticated in the world, I would say. All of the deer around us are infested with this parasite, but they're not sick, they're living with it. But because it sequesters in the capillaries and venules, it has basically created fibrin clotted nests. You could say fibrin bonded. They're like clots. And so they remain in there. And our anti-malarials, often one adds an antibiotic to an anti-malarial combination. They cannot get into the nests, but You can kill the Babesia that are in partial nests or that are free in the blood, if there are any. And you can make a person better by killing off the bugs that are exposed to the immune system and therefore causing the person to be more ill than the bugs that are, deeply sequestered in nests. So it's a long process of starting low and slow whenever possible. I will often start at tovaquone or Mepron, the yellow liquid, at as little as a quarter teaspoon in people who are very ill, up to in people who are really quite functional and are likely to respond well to treatment, 1 teaspoon twice a day, and see how they react. I tell patients, and I think every doctor who works in this field should tell patients to email them or their office with what happens when they take, their first medication, how they react to it. Generally, you then pursue a course of waiting until whatever herxing happens calms down, or if the person doesn't really herx badly, giving it a week or so, and then ramping up the regimen, adding, increasing the Mepron dose, and maybe adding another anti-malarial like tefenoquine, for which you first have to have G6PD testing to make sure you can handle the tefenoquine. Another very powerful agent I add is artesunate, oral artesunate, which is, it's like artemisinin but more potent, and it's available through Chinese sources in the U.S. here. Dr. Zhang's herbs in particular, he sells an RTM that is much more potent than any over-the-counter artemisinin. And then again, start low with that if one wants and ramp up gradually. Additional agents are you can add an antibiotic at some point. It does help, like azithromycin, which is part of the regular mainstream regimen for babesiosis. They use a tovaquone and azithromycin. I started with those, and added the RTM and one other agent. Yeah, and Crintofel, RTM, azithromycin, and a tovaquone. So a study was done at Yale that found that Babesia species are 1,000 times more resistant to anti-malarials than malaria. So this organism is highly resistant, and it is sequestered in these nests throughout the person's, capillaries and small veins throughout their body. So one really has to hit it hard. I believe in increasing until the person is on all 4 medications, maybe less if there's tolerability or affordability issues, but whatever it takes to get them better. And then, because the organism is in these fibrin bonded nests, what I would do is, when they are tolerating all 4 of the anti-malarials, and that would include increasing tefenoquine. It's a weekly anti-malarial, long-acting, it's the most powerful thing we have against Babesia. I would, increase it up to 3 or 4 tablets weekly. One has to watch things, and I've talked about this in my PowerPoints. You have to look out for methemoglobinemia, which can occur. It's a known effect of tefenoquine. It's a known side effect, you might say. But I want to stress that these anti-malarials in particular do not have side effects that people attribute to them. People get sick when they take them because they're infected. And that has resulted in people thinking that Mepron causes psychosis, and Mepron causes depression. No, it doesn't. It has killed Babesia, and that makes you depressed, psychotic, have crazy dreams, and so forth. Because remember, these are in the brain, and so there are brain symptoms before treatment, and there are brain symptoms with treatment. So the physician and the patient really have to understand what they're getting into, what it takes to kill off these organisms, and it takes months and months. In heavily infested people, years to get the load down to where they can feel and function relatively normally. In less infected persons, maybe several months of the antimalarials and some herxing and some improvement. And I've had some who just quit after that stage because they feel so much better, and they may stay better indefinitely, although some do, start to get worse after time off the regimen. So that's the treatment in a nutshell, I guess I would say. It's long.
Yeah, clearly, especially with chronic infection. I mean, it seems like the infections take a lot of the patient, so you need to take a lot of time in order to ensure that you can help them find a path to get better.
Right. You may have to back off the antimalarials, and you have to reduce the dose. In some cases where people are extremely ill, they may not tolerate treatment at all without some sort of immunosuppressive aid like hydrocortisone or prednisone. That's really, fortunately needed only in the very worst cases. But for some people, unless you control that immune system reaction, they will not tolerate the treatment, and or may get even more ill with the treatment, may get severe inflammation.
So looking at our Q&A section here, there's a lot of follow-up questions to everything that you've just described on the treatment side of things.
Okay, let's hit them.
I first wanted to state, I saw somebody ask, will a recording of this session be available? Yes, it is being recorded. And given that all of you have signed up, you will receive a direct link to review this entire presentation. I know Dr. Lindner has talked a lot of specifics, so I'm sure it'll be helpful to rewatch after. But let's just jump into a couple of these questions here. I will start first with one that I had expected us to receive. I even told you about it beforehand, which is Babesia curable? And if not, how does one manage it for the long term? Because
of this fibrin bonded nesting throughout the brain and body, I do not know if it can ever be completely eradicated. I have not seen it in almost 2.5 years. We are still wiping out bugs in my daughter, large numbers of them. So I don't know. I do not know if it is ever curable, but I do know that killing the bugs and reducing their numbers brings improvement. And in some people, it can bring improvement to the point that they feel just fine. And how long that'll take depends on how big their load is and how they react to the organisms that are there. So if, long term, some people may get so well that they just stop and see if symptoms return and get bad. Others might, and I've seen people who just need to stay on a daily dose of some anti-malarial, like Malarone or Coartem, which are combination drugs that can be taken, comfortably twice a day, and are can be relatively less expensive. So that's the long term I see.
Yeah, I think that answer seems to be relevant and true across all tick-borne diseases. As you mentioned earlier, their ability to hide, very similar to Borrelia in terms of penetrating cells, etc. And
I want to say something about that.
Sure.
I believe that the vast majority of what people think is chronic Lyme disease is chronic babesiosis and or chronic bartonellosis. And it's a historical residue, shall we say, because Lyme was the easiest and the first to detect of these tick-borne illnesses. Almost nothing was known about Bartonella until the late 1990s. And this Babesia information is brand new. It only in 2021 did a tick expert who also got the idea that Babesia odocoilei was infecting people. He did find Babesia odocoilei in 2 people who had chronic treatment-resistant babesiosis. That is 2021. Up until then, everybody thought, oh, Babesia microti, no big deal, 10 days of atovaquone and azithro and everybody will be fine. No. So many people and many Lyme doctors have been blaming Lyme, chronic Lyme, and for what is actually infections with Bartonella and Babesia, which are much more sophisticated parasites than Lyme. Both of them are, but Babesia the most sophisticated of all. So that's why, I'm arguing we got to get away from this language of Lyme and co-infections. Babesia and Bartonella are not co-infections of Lyme. They are infections in their own right. And Bartonella is probably can be obtained from ticks. There's a lot of suggestive evidence, but it's definitely very easy for people to pick up from interactions with animals. Cats, cat scratches, bites. Bartonella henselae is what causes cat scratch fever. What has not been known is many people either don't get the fever or get the fever and remain infected indefinitely. These parasites, Bartonella, do not go away. All of these can be passed from mother to child too, which is a huge problem that medicine needs to start dealing with.
Yeah, that's another one of those situations where there's been more acknowledgement within the past couple of years of congenital transmission, and it's something that hopefully we'll see an increased amount of research.
It's been documented in all of these infections that we've mentioned, the three.
Yep. Awesome. Well, I mean, I know that helps answer at least one of these questions here. Let's move on a bit. It seems you may have mentioned a Dr. Anderson. Somebody said that they have seen Dr. Anderson's checklist. And do you think that the symptoms of Bartonella and Babesia odocoilei overlap at all?
Yes, there is overlap in the symptoms. I think his checklists and are pretty good at helping you to differentiate between them. But here's the complicating factor is that many, many people have both of them because Bartonella is so easy to obtain. You play with, stray cats when you're a kid and you're going to get Bartonella. Basically, you're just not going to avoid it, or a lot of other animal contact. The fleas help to transmit it from dogs and cats to humans. So if fleas bite humans, they scratch the Bartonella into their skin from the flea's feces. Other insect bites appear to transmit Bartonella. And when people have Bartonella first, this is a kind of another layer of the onion. If somebody's gotten Bartonella first from birth or early in life, it's clear to me that when it's immunosuppressive, Bartonella generally suppresses the immune system reaction even to other organisms. It does this more so than Babesia or other infections. And so when people get Bartonella first and then get Babesia infection, they react less to the Babesia and the Babesia proliferate more. So they're less likely to get, severe fever and all that stuff when they first get infected. And they're more likely to end up with a more heavy infestation of Babesia if they also have Bartonella. And Bartonella too may be relatively asymptomatic, might just be some achiness and skin changes, but it too is a chronic infestation and also a parasite that doesn't want to kill you, but it will make you sick to some degree or another. So that combination is very common in what I see. I just simply do not see chronic Lyme disease. I don't see it. Other people may see it. Maybe they are treating chronic Lyme disease, but what I see is chronic babesiosis and bartonellosis. And both of those can be tested for as to whether they are ongoing infections because they're in the blood. Like we don't have a test to prove that somebody still has Lyme unless you get a positive PCR, which is very rare. Mostly we rely on antibody tests, which say that you had Lyme if they're quite positive. They're overread, in my opinion. Any Western blot band is thought to mean the person has had Lyme disease. I don't think it does. I think you have to have a lot of bands and a lot of distinctive bands to prove that there was Lyme in the past, but it could be cured. It doesn't mean you have Lyme now. But these two infections, thankfully, are vascular infections, so we can see evidence of current infection in the blood with FISH tests, PCR tests, and who knows, better tests that will be developed in the future.
Agreed. I think we all know that diagnosis still has a long way to go, especially in this realm of the world. So moving on, I have a question from Deb Blumenthal. She said, you mentioned that symptomatology with no spleen or dysfunctional spleen, would you expect to also see low RBC count simultaneous with chronic infection?
I do not see low RBCs in chronic infection. This has been described in dogs with chronic Babesia canis, but in humans, I have not, maybe one patient. I've seen one patient with, kind of a mild anemia or some mild complete blood count changes, but mostly they are perfectly normal looking because it is sequestered. It's not getting into RBCs that are traveling through the body and ending up in the spleen. You see, that's the spleen's job, is to take out abnormal red blood cells. Well, these bugs are so sophisticated, they don't even get into the circulation. They very much try to avoid it. Surely there are some traveling around once in a while, but you cannot see them on blood smears because they're so rare.
Awesome. That will likely be very helpful to Deb. We also have, I'm just working my way down the list here because we got a lot. Is there any information on Babesia coming out of dormancy or flaring after a brain injury? This is something we see with our recipients.
Yes.
Okay, perfect.
Indeed. So you have these organisms sequestered in these capillaries and venules throughout the body. Anything that disrupts the blood vessels will release some of these organisms into the bloodstream and or into the nearby tissues, possibly if there's a severe tissue disruption. So it will, I think head injuries can be complicated by, babesiosis. Also, surgeries seem to make people sicker. You cut through their tissue and you open up a bunch of capillaries that are, Babesia infested. I see if you just simply do a lot of activity, if you use your brain, you bring more blood flow to these areas where Babesia nests are. Some of them are not, completely formed, and you actually flush some Babesia into your system. So people with babesiosis often will feel worse after activity, even have these Herxheimer symptoms, fatigue, malaise, and so forth. Anything that ramps up your immune system to the parasite can make people sicker. And this is where I think a lot of long COVID may be the result of basically COVID causing a very strong immune stimulation, and then the person becoming more reactive to their chronic babesiosis. That I've seen it personally, but of course, much more research would be needed to be done to see to what extent that accounts for other cases.
All right, a good follow-up to that is, let's see.
May I just simply say, though, I am overwhelmed. You said I've dedicated my life to this disease. No, it has taken over my life.
Yeah.
But I actually cannot take new patients, and that's on my website. I tell everybody that. I'm trying very hard to educate other doctors and patients so that everybody can start understanding this disease and treating it.
You are definitely not the only provider that I've talked to in the space who has expressed very similar situation, that they've been working on it for decades. And it's really like, how do I train the next generation of people to come in and help take this over?
I'm working on publishing articles in mainstream papers, but it is something so far from their ability to comprehend and so far out of their comfort zone that it's hard to get them to even listen.
So I think this question from Stephanie will be helpful for the patients that are on this event. Is what does Babesia O's Herxheimer look like, and would it be different than a traditional Herxheimer reaction?
It involves severe fatigue, severe brain fog. You can have overall flu-like symptoms, achiness, and so forth. Worst cases, people can actually be rather delirious, like unable to think at all, because these, again, they're in the brain, and so you're herxing the brain itself. There can be marked psychiatric reactions. The Herx from Lyme disease is described in conventional literature, and it's basically, just a day or two of flu-like symptoms after giving people doxycycline or ceftriaxone. I have a suspicion that that's the only Herx you ever get from Lyme. I think it's very relatively brief, and the organisms are are relatively well dispatched by the usual approaches of 2 weeks of doxy, or if it's neuro-Lyme, a month of ceftriaxone. But it's Babesia that's causing the chronic long-term herxing, the never getting better, because if your regimen is not strong enough to reduce their numbers, you will never get better. So this is a real dilemma. If you're given a weak regimen, you will just herx forever and never get better. That's why I talked about ramping it up to the 4-drug regimen, and then adding lumbrokinase, which can bring even much greater improvements by starting to dissolve the nest, but that brings more herxing also.
So this actually takes it back to what we were just talking about with you educating the next generation. Is for those who are currently working with physicians, what is the best way to engage your primary care physician about babesiosis?
I don't think you'll have any luck with your primary care physician. They live in a box defined by conventional ideas, conventional guidelines, conventional rules. But to find a physician who's willing to consider and understand tick-borne infections, including babesiosis, I have put out a lot of materials. I have a 4-hour seminar also talked about endocrine issues and Babesia odocoilei available through iLads. I have, people will see treatment guides and PowerPoints, that I have put out there or available through iLads again. So these doctors simply, they need to think about doing these tests at these labs where they will never see it, the ones I mentioned. They have to consider that they need to find the cause of the patient's suffering and figure out why they are herxing the way they do to various things. Like I said, an anti-malarial herx means it's babesiosis. So forget Lyme, it's babesiosis.
I see a lot of questions here, very specific about treatment methods and things like that outside of what you've already talked about. So I thank you all for posing those questions. But at this point, given the time we have left, and also our restrictions as a nonprofit, I will not be moving forward.
Yeah, I have a PowerPoint that they will probably find that gives a lot more details about the treatment.
Okay, is that the one that you had shared with me previously?
Yeah, I think you can share that with everyone.
Yep. Okay, perfect. So
that is your way of giving it to them.
Yep, I am very happy to do that. Everybody, as I mentioned, I will follow up tomorrow with this link to the video, and I'll also make sure to share Dr. Lindner's full PowerPoint from his most recent iLads presentation on this topic. So that should provide some more specifics because we're really running out of time at the moment. But I thank you all for posing these questions because that's why we host these type of events, is to get more information for the patient population. So the last question that I'll want to ask before we finalize everything is one that I actually typically ask, and somebody put in the Q&A here, is that over the past several years, federal funding for Lyme and tick-borne diseases research has increased substantially. However, this individual is stating that they're concerned as to how this funding will be awarded. Will it take patient concerns into effect, etc.? Basically, what do you feel can measure the affected change of this increased research funding over the coming years?
Well, it'll be a total waste if it isn't put into Babesia and Bartonella primarily. And so it is a total waste unless it is guided by an actual understanding of what's infecting people and what it's doing to them. So there has been no real progress in the mainstream on any of this, except for Lyme disease, I would say, in the last 30 years. The mainstream is very slow to understand Bartonellosis, even though it is extremely well studied. At North Carolina State Galaxy Diagnostics, that's where one gets BART testing, because it's the world center of Bartonella, and nobody else can find the organisms, from my experience, except NC State Galaxy Diagnostics. So their antibody test is very good, and they're growing BART from sick people's blood all the time. And the mainstream doesn't believe it's a chronic infection, and yet they're growing it all the time from people's blood. So the mainstream has got to get on board. If money's going to be spent, it's going to be to get rid of the current leadership in infectious disease and bring in a new one.
I think there's a lot of people who would likely agree with you on those statements. For those interested in participating in future advocacy about Lyme disease and other tick-borne disease research, Project Lyme sponsors the Lyme Fly-In through Center for Lyme Action, which we are going to be promoting registration for in the next day or so. So for those of you who follow us, make sure to check that out. The more advocates that we have present that can speak on the issues that Dr. Lindner has been talking about, the more of an impact we'll be able to make. So I think that's all for this evening, Dr. Lindner. Thank you so much for spending this past hour with us and providing a lot of detailed information and sharing.
You're welcome. You're welcome.
As you mentioned, your past 20 years or so that you've committed of your life. So thank you for your hard work. And I hope that Project Lyme is able to support it moving forward as much as we possibly can. So thanks again.
Okay.
All right, everybody have a great rest of your evening. Bye-bye.